Gauntlets. I am an occupational therapist and owner of Threshold Therapeutic. I am back with my community partners at CareWorks Mobility today to complete our patient lift series with one additional patient lift. This is a stand assist lift. This is purely manual. There are no electric components required. That being said, it is lightweight, it is easy to maneuver, and fits in smaller spaces. This you may commonly see used in a rehab facility. Today I'm going to show you how it works. Before we get started, there are a few things you should know about stand assist lifts. 1, the client must have intact trunk control. This is because there is no sling. This makes the overall process for the transfer quicker and more efficient. However, this means that the client needs to be able to support themselves sitting upright without any assistance while using this device. 2, the client must have some functional strength in their arms and legs. There is no motor or hydraulics, which means that the client needs to be able to pull themselves up into a partial stand and maintain that position for a few seconds in order to be able to use this device. 3, they must have the cognitive ability to follow directions while using this device for safe use. Now, let me show you how it works. All right, we are set up and ready to go with my client Morgan today. She is going from the bed to the wheelchair, and so we're going to get set up and ready to do that. The first thing that you're going to do is take your lift and line it up with the patient's feet and put them up here on the foot plates. You want to get it close enough so that that knee pad is touching their shins. Once we're here, Morgan's going to reach forward and grab onto the handlebars in front. I'm going to get her in place, and then we're going to count to 3, lock these brakes. She's going to pull herself into a partial stand. Once she's in that position, I have 2 pads right here that I'm going to flip in place that are going to go behind her, and it's going to give her a place to perch for a minute while we get over to the wheelchair. So we're going to pull up into a stand on 3. Here's 1, 2, 3. And when she's in that position, quickly fit the pads down, and now she can sit. There's no requirement that she maintain that partial stand. She has a sturdy surface to sit on. I'm going to go ahead and unlock my lift. Now we're going to go ahead and turn over and head into the wheelchair. I'm going to get her lined up and widen out the legs on that lift so that I can get around the wheelchair. And get her centered on the seat. Once we're in place, I'm going to go ahead and lock my lift. We're going to do that partial stand one more time. I'm going to count to 3, remove those pads, flip them away, and then she can slowly sit herself down onto the wheelchair. We're going to lift on 3. 1, 2, 3. 1, 2, and slowly go ahead and have a seat. And that's how we use a stand assist lift. If you have questions, concerns, want to learn more, please feel free to head over to our blog at thresholdot.com. And again, as always, if you're considering a lift for your loved one and you have further questions, please seek out a therapy evaluation. As a home care therapist who specializes in lift devices and durable medical equipment, we'll be able to help you make that decision on what best will fit your needs. Thanks so much for watching the Home Care OT. Please like and subscribe to stay up to date with our content. And for more information, head on over to our blog at thresholdot.com.